Hi Mama, welcome to part 3, the last video of this 3 videos mini-series where I try to give you the skills necessary to understand if your sign, if your symptom is a good reason to go to the hospital or call your midwife or doctor. In part 3, in this video, we're gonna talk about when to go to the hospital when your concern is not labor related. So I wanted to take this video quite seriously because those events that I'm gonna talk about, they need urgent medical review. And you don't want to mess around, you don't want to wait your appointment the next day, you don't want to wait the morning to call if you experience one of these symptoms. Another thing that I want to point out is the difference between a sign and a symptom, because I kind of use them both in these videos, but I want to make sure that you understand the difference. So a sign is a objective event that can be diagnosed or observed by someone else. So signs of labor are your 4 centimeters dilated and I checked it via an internal examination, or I palpate your contractions and I say that they are 3 every 10 minutes. Those are signs of labor. A symptom instead is a subjective perception of that event. So you might have flu-like symptoms, you might have a symptom of labor, although we don't use this word with labor because labor is not a disease. Labor is something normal, something that happens, so that's why we don't talk about symptoms of labor very often. I personally never use this word related to labor. But you can have pre-eclampsia symptoms, and I'm gonna tell you, for example, what I'm talking about in details very soon. These events that we're going to talk about in this video are pregnancy related and they can happen at any point in pregnancy. So please don't underestimate it just because you're not 37 weeks or because you don't think you are at the point of the pregnancy. They require attention at any point of your pregnancy. Let's talk about the first one, reduced fetal movements. That's a very good reason to go to the hospital and to let your provider know. Babies usually start to move, you start to perceive their movements around 20 weeks, especially if it is your first baby. Sometimes second-time moms, third-time moms feel movements even as early as 16 weeks. But definitely make sure you let someone know if you have not felt any movement and you are 22 to 24 weeks, because by then you should really be able to feel your baby moving. Those movements, they can be described by wish, flutter, rolls or kicks. And there are so many different perspectives of how women perceive fetal movements. But generally speaking, you'll know what's normal for your baby. So there is no magic numbers that allow me to tell you, oh, your baby is moving less than normal, because you're gonna be more able to know that and to understand the pattern and the kind of cycle that your baby does in your belly. However, if you perceive after 28 weeks that your baby is moving less, you want to definitely pay more attention to that event. Sometimes if you're busy doing other activities, you might not notice, you might think that your baby is moving less, and while it might be a thing that is happening to your baby, you just want to take a moment to focus on the movements. I would say close yourself into a dark room and focus on your baby movements for the next 2 hours. If in the next 2 hours you feel at least 10 movements, then you are kind of okay. However, if there is something in your gut telling you that your baby is just moving less or you're not sure, just go to the hospital. Also, be aware that babies have a cycle in your womb, so they go to what we call a sleeping phase and then they are active. However, the sleeping phase usually does not last longer than 90 minutes. So be aware that if your baby is moving less, then it might be because he or she is in a sleeping mode. But then again, by the 90 minutes, you should really be able to feel something. Also, some research says that baby respond to glucose and to external stimulus, such as if you drink a juicy drink, or if you move, or if you do particular things, and other evidence that it is not. Again, this comes down to how much you know your baby and what it is normal for your baby. Also be aware that after up to 32 weeks, your baby is likely to increase the amounts of movements, while around 32 weeks he or she is usually likely to plateau and don't increase the amount of kicks. This doesn't mean that the kicks are gonna be less, just they're not gonna go with this hyperbolic pattern that they've been doing up to now. This is because the uterus is getting tight for them. They are growing, they're bigger, and they have less space. So it might be that the reason why you're gonna feel the same amount of movements. You might get worried, but it's just a normal physiological event that happens. The perception of your movements might also be influenced by the baby position and by your placenta position. Women that have an anterior placenta, meaning the placenta is in the front of your uterus, meaning just on your belly, they're less likely to feel movements. This is because the placenta is kind of like a barrier that prevents you from perceiving those movements that are actually less intense, or those kicks that are less strong. And as well, if your baby is in anterior position, and this is especially at the end of the pregnancy when they're preparing for labor, hopefully they're gonna turn their back and anteriorly, meaning they're gonna kick basically your back, your spine, and these movements are a bit harder to perceive as well. Another urgent reason that I want you to go to the hospital immediately if you see this event happening is bleeding. Bleeding is never normal in pregnancy, you understand that. It might be caused by different reasons. It might be a simple bleeding from your cervix, maybe you have an ectropion, maybe there is something that bled in your vaginal walls, and that's alright, it still requires attention. Or it might be coming from inside your uterus. It might be because you're having a placenta previa, meaning the placenta is actually covering completely your cervix. So when your uterus moves, when you start to have Braxtonics, or simply with the growth of the uterus, then the placenta is likely to slide and move a little bit, causing this bleeding. Also, another type of placenta that might cause frequent bleeding is the low-lying placenta. A low-lying placenta is a placenta that, although not previa, although not covering the internal os of the cervix, is actually just at the border, just there. So again, as soon as the uterus grows a bit more, or as soon there is something going on with the placenta, then you're likely to bleed. Hopefully that bleed means simply that the placenta is moving a little bit up and you want it to be away of your cervix, because that's the all that your baby will need to come out. But again, you just need to be sure and check where that bleeding is coming from. Another reason why you might bleed is because of a placenta abruptio, and that requires immediate, urgent, emergent care. A placenta abruptio happens when a part of your placenta, of all of it, hopefully not, starts to separate, although your baby is not close to be delivered. You might not even be in labor, and you're actually gonna start to bleed quite a lot, and your baby is gonna be deprived from a part of oxygen that was receiving before through the placenta. So please, I'm sure that you're gonna be aware that you have to go to the hospital, but I just want to remark that even if the bleeding is a small amount, you still need to go. Now I'm gonna show you, if I can, even like a tiny amount of bleeding is not normal. Like, look at this, like it might not look like much. Now bear with me, this is my hair coloring mask. This is actually quite realistic. You might be able to see some clots in the blood loss that you had. This is a pad. I don't want to use a huge pad because I don't think you're likely to go around with a big pad during your pregnancy. So I just wanted to let you understand how even a tiny amount of blood can be considered dangerous. I knew I was gonna make a mess. I want you to go straight into the hospital if you see anything like that. Another reason to go to the hospital straight away is if your water breaks, or if you're having contractions and you're less than 37 weeks. I know we talked about being able to spend a little bit of time at home if you're starting to having contractions, or if your water goes and you're having a low risk pregnancy, but if you're not term, if you're less than 37 weeks, you want to go straight away, because that's a sign that there is something that is going on, and you definitely want to be sure that your baby is fine and that you're not going into what's called preterm labor. Also related to the water, and again I talk about in depth in my video related to the water breaking, is if you see the presence of meconium. Meconium is the poo, the bowel motion that the baby does inside your uterus. It usually presents like a dark green, nearly black color, and if your water are even tinged and even a little bit kind of greenish, you want to make sure that you let your midwife know and you go to the hospital to be checked and make sure that your baby is okay. And then finally, let's talk about 2 events that require urgent care, meaning you kind of have to go to the hospital within the next 2-4 hours, because it might be absolutely nothing, you might be just that you're worrying for something that is not, but it's definitely worth to check it out. And those are DVT symptoms, deep venous thrombosis symptoms. Pregnancy and postpartum are themselves related to a higher risk of developing clots and deep venous thrombosis. And this can be extremely dangerous when these clots move and they go up to your respiratory tract, causing pulmonary embolism. Why this happens? Your body during pregnancy prepares itself for the major effort of the bleeding that is going to happen during birth. So it kind of increases its capability of being able to clot blood faster. Again, just to prevent you and to protect you from a possible hemorrhage that can happen during birth or in the postpartum period. And that's great that your body does that, but at the same time it increases up to 5 times the risk of developing a DVT. How can you notice this symptom? Well, women at the end, especially at the end of pregnancy, they're highly likely to report that their legs and the ankles and the feet are swollen, hands as well sometimes, and that's normal. That's an edema related to the end of the pregnancy. Your fluids are trying to escape of your body and they just don't know where to go, and they go to the extremities, making them feel bigger and swollen. However, if you see an imbalance between your ankles, for example, or your 2 calves, then it might be a sign that requires a bit more attention. It can be seen as a swollen part of your calf, your thigh, your foot, or it can also cause discomfort as you walk and as you mobilize, or of all of that. If you think that there is something going on in one of your leg, that especially, I say leg because most of the cases is in the leg, but it can be anywhere in the body really. But if you think that something is different, that there is a part of your body that feels hard, that is bluish, that it's painful, that was not there before, then you do want to make sure that you go to a checkup. Last but not least, you want to go to the hospital if you experience pre-eclampsia symptoms. As I was saying, those are kind of symptoms that might be related to pregnancy, might be related to the fact that you're simply tired one day, but still they require attention. And those are headache, frontal headache, blurred visions, and epigastric pain. These 3 symptoms might be related to preeclampsia. Preeclampsia is a pregnancy-related condition that involves a defect that might happen in your placenta after 20 weeks. We are still not 100% sure of the causes of preeclampsia, but we know that it can be extremely dangerous. Most of the cases they are just presented into a mild form, and they might just require oral antihypertensive or extra monitoring to you and to your baby, but still it does require attention because it can cause fetal and maternal morbidity and mortality. Also, the early it's diagnosed, the sooner the better those symptoms can be managed. So if you experience a headache that you didn't have before, make sure you're hydrated. Maybe take some paracetamol, always call your doctor or midwife to do that. But if the headache is still there after 2-3 hours, then you want to make sure that your blood pressure is okay. Preeclampsia usually interferes with your blood pressure readings, meaning that your blood pressure tends to be higher, and then it's usually associated with the presence of protein in the urine. Those are signs of preeclampsia, but you can't measure it at home. You're not unless, even if you have a blood pressure reading, you want to be sure that this is measured by a healthcare professional. And then protein in the urine is actually another sign of possible preeclampsia. So please do make sure you go to get checked if you're experiencing headache, blurred vision, or a kind of this epigastric pain just under your rib cage. That's all for part 3 of this video. I hope it helped. I hope it didn't scare you more than I wanted to. I just feel that sometimes during the short appointments that you have with your midwife or doctor, there is not enough time to discuss all of these events that can happen in your pregnancy, and they might require medical attention or they might not. So I hope that with these 3 videos you're gonna be able to understand what's happening to your body and what is absolutely normal and what instead requires a bit more attention. And I'll see you next video. Bye, mama.